Can you share a little bit about what are some of the reasons
Mhm,
people seek, whether it is counseling or therapy, that they
mhm.
come into your practice?
A lot of times people will seek help when the existing set of skills that they have to handle something is no longer working. So the stress might be the same, but they've been trying the same thing, the patterns, right? That's where we notice the patterns. They've been using the same thing, but the outcome has not been the same. That would be one of the things. And it's typically we see it when people are going through some life changes. So people go through things like, empty nest syndrome. They will go through divorce. They will go through even getting into a relationship, out of a relationship, right? Job changes. There are many things, many times in life when there's that gap, that's what they feel, and they come in at that point of time. Sometimes they're there when the distress level. So that's stress. Stressors are what comes. They're probably more short term. They are turning into something more long term, and the client feels a sense of helplessness that I've been trying all of these things and I'm not getting to do anything. One-on-one, a stress to a stressor in life, right? Sometimes stress on a very long-term basis turns into distress, right? So that's when they are dealing with something more than just stress, and that's when they are feeling pain. They can't make a sense of that pain. It's real, but because the kind of pain that you and I see in our work cannot be discerned with a blood test or typically with a scan or anything like that, the pain doesn't even seem real. So they'll come over and they'll say, I don't even know how to make sense of this pain, right? And then sitting there labeling it, helping them understand whether there's a distinction between a clinical piece or not. That's sometimes when people just come in, and sometimes just knowing that they have something that's real, and then getting the help around there, even directing them for medical intervention later, so many other things, right? So pain, distress, stress, distress. And again, when it is, sometimes they come in because somebody in their family told them they better get their act together in order to in order to be better present in their relationship. Sometimes it's that relationship piece that also comes in, right? So these are various reasons why we see clients in our practice. And parenting, again, a big thing. Conflict, just conflict across lifespan is something that is also why people seek out help, right? To just understand conflict, to understand themselves better. I wouldn't do therapy for my friends. There's a reason why we have these ethical boundaries. Mental health is real. Listen to yourself. You are your best judge. Therapy works. Making the fit with the right therapist. That's where the actual work is. You are important. Your mental health is just as important as your physical health.